G'day. Thanks, Cameron, for that fantastic update, and thanks, Deputy Premier. So I'd just like to update firstly on rapid antigen tests. The first deliveries of our rapid antigen tests will be distributed over the next few days to our priority workforces, at-risk Victorians and community organisations. We've got another 5 million RAT tests scheduled to arrive very soon. As Prof Ben Cowie said yesterday, for most people in the community, your rapid antigen test will be your first port of call for testing. As they become more and more available, you'll use them when you've got symptoms, you'll use them as a close household contact or household-like contact, and you might use them as you're going to work, as you're going to indoor spaces with a number of other people, or going to visit elderly parents. So we're reshaping our COVID-19 response around this technology. It's great to see Victoria's really taken charge as the first state to distribute them free, the first state to order and receive supplies of this magnitude, and there are tens of millions on order, and the first state to record and report those positive rapid antigen test results, which has given us a really useful picture of how much COVID is out there. We are very confident in its accuracy, and that really does relate to how much Omicron is out there at the moment. When you've got really high prevalence, then when you get a positive rapid antigen test result, we can be very confident that it's a true positive result. And so when you get that positive test, you need to regard it as a proper positive. You need to isolate as a positive case. So we want everyone in the community to have that understanding and to share that understanding about rapid tests. The work with multi-faith and multicultural communities is really important to understand all of that information about rapid antigen testing and also our vaccination program. So we are working with 60 multi-faith and multicultural community organisations to provide them with rapid antigen tests to distribute within their community on the basis of need, and representatives from those organisations will receive remote training on how to use the test, how to report those results, and then messaging about how to use them at home. We're all getting a little bit more familiar, but it's not necessarily straightforward to understand exactly how you do it well and how you read those results. Some participating organisations include the Islamic Museum of Australia, the Afghan Women's Association, Community Response Australia, the Filipino Community Council, the African Women's and Family Network, and Multicultural Youth Social Services, and several others. It's small, but it's a very meaningful distribution initially, as these organisations work on their own distribution channels and the training methods for their communities. It's being led by the Department of Health's Rapid Response Engagement Team, the same group that successfully worked with these communities to build an understanding of PCR testing. On a different topic, managing COVID at home, with tens of thousands of cases in Victoria, indeed in Australia every day, it's really important to have an understanding of how to manage COVID at home. They're important things that all Victorians need to understand and remember over coming months, not just for now. Everyone should have a plan to isolate, including a nominated person who can drop off food safely or look after pets. Everyone should be practicing good habits around ventilation at home, whether or not you're positive, and that means opening windows, internal doors to let fresh air come through your homes. Knowing your symptoms and knowing when to escalate appropriately. If they're mild, rest up, drink plenty of fluids, take simple painkillers. But if they get worse, you can call your normal doctor, you can call Nurse on Call for information. That number's 1300 606 024. And if they're severe, having difficulty breathing or worsening shortness of breath, and it's an emergency, then you should call 000. On boosters, as the Deputy Premier said, we've got 1,229 COVID cases receiving care in hospital. Getting your booster is another 88 or thereabouts reduction in risk of hospitalisation compared to 2 doses. It's a really significant additional protection that you can have. So we really need to make sure that we're protecting each and every person who's eligible for boosters to avoid hospital, because those hospital numbers are going to increase. There's a lag compared to our daily case numbers, and over the next few weeks we will see hospital numbers go up. So anyone who's eligible, but particularly older Victorians, need to make a plan to get their third dose as soon as possible. Our second dose coverage, obviously good protection, but that third dose really important, because second dose protection does wane over time. So before you get back to work properly and in coming weeks, get that added protection the moment you're able. Visit a GP or pharmacy by Googling Clinic Finder, or go to a state-run vaccination clinic. Go to www.coronavirus.vic.gov.au to find out where. And if you know someone who needs extra help in getting their vaccine because they've got a disability or need a translator or for other reasons, there's a lot of information online on that coronavirus website about the systems we have in place to help you. I'm happy to take questions.
Professor, just in terms of case numbers and hospitalisations, do you think we've peaked or we're close to peaking when it comes to case numbers?
Look, there's a lot of uncertainty, but I do think we're reasonably close to peak if we're not at peak already. Clearly, the picture from around the world, South Africa peaked in a reasonably short period of time. The UK looks to have peaked. Some states in the US, New York, New Jersey, look to be peaking with their case numbers. But we've got a high proportion of PCR tests coming back positive, so it does mean there are a lot of people out there who don't know their status. When you've got 30-odd% of tests coming back positive, that means there's a lot of undetected cases as well. So we need to get the biggest and clearest picture possible. So that does mean please get tested if you're a close contact, if you've got symptoms, RAT test or PCR accordingly.
And hospitalisations, you expect it will be a few weeks, perhaps?
Look, they'll lag the case numbers by a couple of weeks for people admitted to hospital, and for ICU probably by 3 weeks. So that will peak sometime in February, maybe mid-February, but it's hard to know until we really see what the peak in case numbers is going to be. No, it is hard to know, but when you've got that high proportion, 1/3 of cases who are coming back positive on the PCR tests, then it's a pretty strong indication that there might be at least that number again out there who are positive, who don't know it. There'll be a lot of people who, because they're double vaccinated or triple vaccinated, will have very mild symptoms or no symptoms at all. Obviously, people with no symptoms who aren't close contacts aren't going to present for testing, so we'll never see them. But there are probably at least the same number again in daily cases. Look, it's not here until it's here. There are a number in flight or that are going to be on the ground very soon, but they obviously still need to be distributed to all of those settings. But we're pretty confident that's going to happen over the course of this week.
In terms of, sorry, it was hard to get a last question. You're talking about vaccines or rats?
That was about rat testing.
When it comes to vaccines, from your point of view, clinical point of view, the logistics of getting these younger vaccines to pharmacies, GPs, state hubs, how is that going? Is there a concern within the Department of Health about some of the pharmacies not getting the stocks that they've ordered, and perhaps maybe that's slowing out the rollout there?
Not that I'm specifically aware of. It is a Commonwealth responsibility to distribute to primary care and pharmacies. Our state hubs have an appropriate supply. They've obviously still got bookings available, and I would just reinforce again, please book in. If you're due now, please get that booster dose. The protection of someone who's triple vaccinated compared to someone who's unvaccinated is is orders of magnitude difference. Someone who's in their 20s or teens who's unvaccinated has the same risk of being hospitalised as someone who's got their booster dose or third dose who's in their 80s. So it's extraordinary how protected you can be. It's direct protection. There's still a risk of getting infected with Omicron. That's how Omicron's changed the landscape here. We don't have the complete protection against getting infected, but we've got that direct protection against significant illness, getting hospitalised, getting into ICU. That's what we need to emphasise now.
What's your advice to those that have been infected with COVID and might be concerned about the long-term health effects that could come after, say, the 7 or 14-day prognosis period?
Look, obviously there are some persistent symptoms that occur. Headache can be long-standing, cough, shortness of breath, fatigue. People need to check in with their primary caregiver in that regard, their GP, to make sure that that's managed appropriately. But this is a pandemic that hasn't played out over the long term yet. We're going to have more people infected in recent months than we've got in the entire previous period of the pandemic. So we need to get a better understanding of what the long-term implications can be. But obviously there's a lot of research going on. Some of it's reassuring in terms of recovery for a significant number of people, especially children, but there's also concerns about persistent changes in organs, in the nervous system, that we need to get as much clarity on as possible, and we shouldn't be complacent about it. That's why vaccination and the protection from severe illness is so critical. Look, I might pass on. It's a national cap question. So
while you're, I presume you can't read yet. While you're away, I understand your acting Professor County made some recommendations to government regarding restrictions and also the pandemic orders, what should be put in place. And one of the recommendations was for a density around 1.4 square metres. Is that still your belief that that may need to come into place at some point, and is that still your advice to government?
look, if I get the question, I'll review at that point in time. But that was a recommendation of Professor Cowie at the time, as it should be. But that's provided dispassionately and with the public health perspective and the appropriate evidence base. But the pandemic orders are for the Minister to decide with those broader considerations. But how it would be, if I were to be asked a week or 2 weeks from now, I would look at it at the time. The closer you get to the peak, the less the impact of new restrictions would be. Certainly if you're past a peak, they're not going to be as substantial in terms of the effect that they have. But we should also consider that public health mitigation measures are only one part of everything we need to do. A density restriction or a density limit is one component, but there are so many other individual and collective behaviours that we know that we can have in place across the board. That is mask wearing, that is keeping social distance, it's dining outside to the extent that you possibly can, it's meeting family members and others outside or in a really well ventilated space. I can't emphasise that enough. They are really key elements that should happen regardless of pandemic orders in place. They are not under review, and I haven't had a request for further advice at this stage. Look, my advice is my advice. You can look it up and see exactly what I recommended over the course of December and what Professor Cowie's recommended. Look, as a country, it's really hard to know what an alternative universe would look like had we taken different measures. It's fair to say that whenever you introduce more stringent public health and social measures, you do have an opportunity to flatten the curve a bit more. The reason you flatten the curve, yes, it might prolong the pain, if you like, but it does reduce the pressures on the hospital system. We know they're very substantial, and we're still going through the midst of it. So it's a balance of considerations in that regard. But countries that have faced the Omicron wave, they've had huge numbers. So I think it was always going to be a significant challenge in terms of the sheer volume of people who were going to get infected with Omicron, especially because the vaccine provides direct protection, but it doesn't provide so much protection on becoming infected and passing it on to others. So we were always going to face a really substantial wave with Omicron.
Massive pressure on hospitals now, as well as the huge staff shortages and the mobility levels to say there's more lockdown. All of those things, are they further proof that it is better to suppress cases because the economic costs are actually the same and you have a massive wave of cases?
Look, I think us public health folk always say that there's a clear correlation with the challenges that we face more broadly in society, not just within the health sector. And so the challenges that the Deputy Premier has spoken about in terms of staff absenteeism and supply and distribution networks are all a consequence of really broad transmission. How much that might have changed with Omicron is difficult to say. Hugely infectious and obviously gets around some of the immunity from previous infection or from vaccination.
What's our next stage after mid-Feb or whenever when we finish? Where do we go from here? I know there's probably some unknowns.
Yeah, there's a bit of wordplay around the semantics of endemicity. Some people use it to say, look, it's going to be part of society, it's going to be part of our landscape and our individual lives going forward. That is absolutely true. But Prof. Raina McIntyre's obviously made the point that it's an epidemic disease. It comes in these waves because of its infectiousness and its ability to evade immunity, vaccine and natural immunity. So it will have these waves. From my perspective, that means that we do need that full gamut of controls in place in the long term that includes vaccination and boosters. It would be great if we get a pan-coronavirus vaccine that covers all variants. It would be great to see a booster that then provides protection against all variants and for a longer period of time. But those other measures around ventilation, around our individual and collective behaviours need to be in place as well. So we need to embed some things for the long term because this is not going away.
Professor, there is talk that the National Medicines Regulator is looking at bringing forward the booster doses specifically for 16 and 17-year-olds. Do you think that's something that we do need to seriously consider as they go back to school? They are coming up at multiple months since their second dose.
Yeah, it certainly needs to be considered. Obviously, we've seen some countries where there's been an approval for that age cohort. We need to go through the review of data nationally through TGA and ATAGI considerations. That's a normal and appropriate process, and it provides that reassurance to our Australian community as well. But I think it's pretty clear that the booster provides that additional protection and that waning of vaccine effectiveness does occur over 4 to 6 months in particular. So it would be great to see it come through.